7th of July, 2024, 10 a.m. Just a reminder, it's a very nice day. I think the sun is breaking through. Our hopes of EuroCop are high, so it's a good note to start with. Just a reminder, this is audio recorded and video recorded, so make sure your mobiles are switched off and also not seen by the cameras. So as usual, what we will do is we will start the recording, and we usually start by introducing ourselves one by one so that we all know who we are, even though we might have known, for a while, but we haven't seen each other for a while. So starting with me, my name is Paul Egil-Shelvan, Councillor for Cramlington Southeast. I chair this meeting. Thank you.
Morning, everyone. I'm Jill O'Neill, Executive Director, Public Health, Communities and Inequalities for Northumberland County Council.
I'm Veronica Jones, County Councillor and Portfolio Holder for Improving Public Health and Tackling Inequalities.
Good morning, I'm Wendy Patterson. I'm the County Councillor for the Long Houghton Division, and I'm also the Portfolio Holder for Caring for Adults.
Morning, I'm Mark Purvis. I'm the County Councillor for the College Ward, Ashton.
Good morning, everyone. I'm Laura Jobson. I'm an Associate Director with CNTW. I'm here on behalf of Chloe Mann this morning.
Good morning, everyone. I'm Kevin Waring, Superintendent for Northumberland.
Morning, everyone. I'm Graham Benning. I'm the Chief Fire Officer of Northumberland Fire and Rescue Service.
Morning, everyone. My name's Sam Anderson. I'm one of the service managers for the 0 to 19 Grown Health team.
Morning, everyone. My name is Sharon Williams. I'm a pharmacist and I'm here representing North Tyne LPC.
Good morning. My name's Jenny Harris. I'm Deputy Director for Delivery for Northumberland North Tyneside delivery team in the Integrated Care Board, and I'm representing Rachel Mitchison.
Hi everyone, Neil Bradley. I'm the Executive Director for Adults at the Council.
Hello, good morning everyone. My name is Jeff Watson. I'm the County Council for Amble West with Warkworth, and I am Portfolio Holder for Promoting Healthy Lives.
Morning everyone, Peter Stanfield. I'm the Chair of Health Watch Northumberland.
Morning everyone, Glenn Sanderson, Leader of the Council.
Hello, Emma Richardson, Poverty Lead, Northumberland County Council.
Heather Bowers, Democratic Services.
Can I ask Pasha to say a few words, and also Jane, please?
Hello everyone, my name is Pasha Tanraverdi. I'm the Head of Service and Business Development for Every Turn Mental Health. We're a mental health charity based in the North East.
And hello everyone, my name's Jane Walker. I'm the Head of Mental Health, Learning Disability and Autism across Northumberland and North Tyneside Local Delivery Team, part of North East North Cumbria ICB. It's good to be here.
Thank you. Welcome once again. So we will formally start the meeting now. First item, apologies for absence.
Yes, Chair. Abby Conway, Rachel Mitchison and Graham Writer.
Thank you. So minutes of the previous meeting. The previous meeting was on 9th of May. Can I pass it on as a true record of what happened on 9th of May? Thank you, Jeff. Yeah, if you may remember, in June we had a closed session going through all the data and analyzing everything, so there are no meetings for that one. Third item, disclosures of interest. Any disclosure for interest? None. Thank you. So we come to the first major item, Northumberland Safe Haven, and the presentation will be online by Pasha and Jane, who just introduced themselves. And when you ask questions, please make sure the microphone is on so that they can hear us as well. Okay? Thank you very much. And Veronica will be introducing, Wendy, oh yeah, I'm sorry about that. Councillor Wendy Pattison, in fact, that's her baby, this Northumberland Safe Haven. So I'm very pleased to invite you to introduce the whole speakers and other thing. Yeah.
Thank you very much, Chair. To say I'm delighted with this first item on the agenda is an understatement. In the aftermath of COVID, and mental health actually is a large part of my portfolio. In the aftermath, I was very concerned that so many of our residents were suffering with mental health issues, anxiety, depression. And so it was purely by chance I found online an article about safe havens in East Sussex. And I thought, what an amazing thing that people were able to walk into a safe haven 24 hours a day and get the advice of a mental health practitioner without having to be referred by a doctor. And so I thought, this is just amazing. So I firstly, I spoke with CNTW because I'm a governor on CNTW. And they knew all about safe havens and they had been discussing them. And I also spoke with Sam Allen from the Integrated Care Board. And I honestly can say that they have both been absolutely wonderful. And so the idea or the seed for the very first safe haven in the northeast, and we've got it in Northumberland, was born. And so this is just absolutely phenomenal. And so I can't thank everyone enough. I want to thank Jill O'Neill, our Director of Public Health and the Mental Health team. I want to thank, obviously, CNTW and ICB, and also, can I make Jane blush and just say Jane Walker has been absolutely amazing and worked so hard for this. And I actually had the pleasure of going with our Executive Director, Neil Bradley, to the opening of the Safe Haven in Ashington and met the staff from every turn. And what a super calming, serene atmosphere there is there. And I just feel so proud that we are the first in the Northeast to have this safe haven. So without further ado, I'm going to hand over to Jane and Pasha to take us through all of this wonderful news. Thank you so much, both of you.
I'll just share my screen.
Thanks, Pasha.
And get the slides on.
Lovely, thank you. So thank you so much, Wendy, for those really kind words. And I know you've been with us on this journey from the very beginning, and you've been so close to it and you've been so supportive. So thank you for that. So we've already introduced ourselves. We're going to have a bit of a game of two halves. So we're going to replicate some of that nail-biting football tournament that we saw last night. So I'm going to kick off and then Pasha's going to continue after me. And hopefully we'll be able to get across the work of this safe haven, and you'll be able to answer questions at the end. Pasha, do you want to just go through? Thank you. So in terms of the sorts of things that we're going to be covering then, we're going to look at first at what our Northumberland Safe Haven is, a little bit about partnership development, identifying the site, the bothy itself, what it is, the pathway, monitoring and measurement, and what helped us to get to where we are now. So quite a brief presentation, but I think that there's a fair amount of content within each of those. Pasha, can you move slides, please? Thank you. Okay. So I'm going to start off firstly by talking about what we mean by a safe haven. It's a term that's used to describe a range of different offers, actually. Offers like crisis cafes or even sometimes community crisis beds. And I think all of these terms are really confusing because they can be interpreted and delivered in lots of different ways. They're often referred to as alternative to crisis services, and they're very often delivered by the voluntary sector. and in partnership and working closely with statutory services and other voluntary sector agencies. The services offer support to people who identify as being in a crisis, but they don't necessarily meet the criteria thresholds for a traditional crisis service. Now, that doesn't mean that there isn't a need. It simply means that their level of need doesn't meet the thresholds for a secondary care service. And what that means is that sometimes these individuals, I think, as Wendy was referring to, often fall through the gaps in services, and that then in itself results to that person's need kind of escalating even further, which means that ultimately they will end up in a secondary care service without any preventative measure having kind of taken place. So alternatives to crisis offer a prevention model that can support somebody, de-escalate, and also explore those underlying reasons of why there has been an episode of crisis. So these are services that really help to relieve pressures in systems and, more importantly, ensure that people find the correct pathway for them in the right settings. So, of course, that was something that we were really keen to ensure we had in place in Northumberland. Because of the confusion around safe havens and what it means to some people, we wanted to be really clear about the purpose and the role of our safe haven in Northumberland. So we knew that we wanted a service that would impact the people who had access to the safe haven, so people receiving the service. And we also wanted to know and understand and support the wider system. So we all know that Northumberland is challenging as an area. Our geographical size, our rurality, our areas of high deprivation and areas of affluence, and the variance between the two, our employment rates, our ageing population. We've got a real mixed bag of challenge there in Northumberland, and all of those areas were things that obviously we needed to consider when we thought about our model for this safe haven. So we knew that because of all of those factors and our geography, this safe haven had to be easily accessible for the whole of Northumberland, and that's no mean feat. So we had to think about making access easy and offering the safe haven to people through a number of different ways. That could be, face to face, it could be over the phone, it could be a virtual model, as many different things that we could do, and also thinking about those other services that we had in place across Northumberland, like the digital service of Cooth. So there were lots of different things that we needed to consider. At the same time, we also knew that there was emerging legislation, national legislation coming through, just as we were in the middle of looking at our safe haven, and quite complex legislation as well around NHS 111 option 2, which is where people can ring 111 and then actually specify that there's a mental health element to their difficulties. And the idea of that is about ensuring that people get to the right place in a much quicker way so they don't go through that loop of what is historically a very physical care-led sort of system. The other thing was around right care, right person, and all of the difficulties, pressures, complexities that we knew were going to be coming about as a result of that. And we needed to consider that in our model. So all of those factors, together with the range of system partners involved in development of our safe haven, and importantly, our experts by experience who have really been with us in the beginning, have produced what we now have called the Bothy. So I hope that just gives a little bit of context around that. Next slide, please, Pasha. So I've just referred there to our system partners. Our partners made up a steering group that was formed at the beginning of our journey. So the steering group was made up of statutory sector providers, the voluntary sector, providers like Health Watch, primary care. We included as many organisations as we could where we felt that there were going to be important either touch points for our client, and thinking about how that wider system works. The steering group was made up of lots of feisty people, as you can imagine. It meant that there was real honest and transparent discussion about Northumberland, about the difficulties that we face, the pressures in the system, and understanding how the Safe Haven could potentially support in those areas, and the wider role that our system partners would play in ensuring that our Safe Haven is a success, because we must remember our Safe Haven isn't an emergency service. It's not a clinical service. This is about helping people understand their own situations and personal circumstances and supporting them in their day-to-day lives, actually, and raising awareness of mental health for them, but at the same time and understanding that this service has and can have quite a significant impact on the way we all work together as a system. So when I looked earlier at the earlier slide and some of the organisations represented there, it didn't include Northumbria Healthcare, the fire service, Talking Therapies and Health Watch, and those have all been really key. And I think that we'd have needed a much bigger slide, and it would have been much too complicated to have included everybody. But something that I think is really important is our steering group still meets. So although we have our Safe Haven in place now, we have decided that the steering group has real significance and importance. So we still meet to discuss progress and challenges, and also for that, and it enables that wider system of organisations to think about lots of different aspects, not just linked to the Safe Haven, but our wider system working. So it's proved to be a really important group, and everyone certainly acknowledges the benefit that brings. That steering group, and I'm really delighted that Janet Aris is in the audience today there in person, because that steering group will also be supporting the development of the Safe Haven in North Tyneside, which I know we're all really keen to get going with. In terms of that steering group, what I have done here is just put through some bullet points around the sorts of things that we talked about. And I guess the things that I've just gone through there: who is this Safe Haven for? How are they going to get into it? What sort of connections will there be across the Northumberland system? Are there going to be any negative impacts of the Safe Haven? What will the system-wide outcome and impact measures be? How are we going to measure it? Really complicated discussions actually took place in that steering group, but as I say, really helpful and have enabled us to get to where we are today. Next slide, Pasha. Thank you. So we've included this because we've had a number of queries around why is the Safe Haven in Ashington? How did it get there? And I can understand why we've had so many queries. Given the size of Northumberland, I think every area, wanted the Safe Haven there. So this has been really difficult, but we did undertake a huge mapping exercise to support our wider community mental health transformation work. And what that did, it helped us to consider a range of demographics to support the placement of this Safe Haven. And it was through that process that that kind of delivered almost a three-dimensional picture of Northumberland and that asset mapping. And that's how Ashington was identified. And if we had more time, I'd love to be able to demonstrate that to you, because it's really fascinating. And we've certainly offered use of that mapping exercise through other pieces of work that were involved with the local authority. So particularly, around some of that communities together work and the emerging prevention sort of model. So a number of properties were considered in Ashington, even an old veterinary practice, I seem to remember. We were really fortunate, though, that our building became available when it did. It had started as a general practice. So whilst it needed renovation and reconfiguration and use of the NHS England capital monies, we did start with a sound platform. It's in a brilliant position on the high street, not right in the middle of the shops, but really easily accessible, with easy access to transport. Bus links are fantastic, and so because of that, we decided to place the safe haven there. And because we've ensured that access to the safe haven is available by people, walking in or by phone and that virtual appointment, we're doing everything that we can to ensure that it really is a service that's available to the whole of Northumberland and not just the Ashington residents. So I'm going to stop there, and then I'm going to pass on to Pasha, and Pasha is going to be able to provide you with a little bit more detail about the safe haven and how it operates.
Thank you, Jane. So Jane's described the building, which is quite right. It used to be a GP surgery on the Burnham Terrace in Ashington. We've included a few photographs here. We'll be delighted to invite some of you to come and visit if you'd like to. But what we've done in the building is a full refurbishment of the space. By the time we took it over, it had been run by an IT company, and we've worked with service user groups attached to Northumberland Recovery College to think about how the space should be designed, what furniture we should choose, how it should look and feel. And what really came through is that people want a non-clinical space that feels really comfortable. It almost feels like a kind of a home away from home, and it certainly feels safe and doesn't have mental health crisis above the door, even though the service is there to support people. So we went on that local engagement, through that local engagement process, to name the building the Bothy, and then to think about how it should be designed. So you can see some photographs here. I think it's a really welcoming space. It really stands out on the street, I should say, being painted purple. But it's a really welcoming and safe space. And what the kind of the other thing I would say about the Bothy building is that it also hosts Northumberland Recovery College. And that was really important to us. The idea that we would have a physical base for the Recovery College, which operates all over the county, but having a shared space where people who maybe visit the Safe Haven in person are able to kind of have a direct link into the Recovery College and its offer was really important. So the site we've described already was a former GP surgery, close to Washington High Street. It's got really good transport links, so directly on a street with a bus stop, to going kind of to and from Ashington all over the county. And that says that also has Northumberland Safe Haven. It should say Northumberland Recovery College. The Safe Haven itself opened on the 1st of April this year, and Jane's described it for anybody who's experiencing mental health crisis or distress in Northumberland. The important thing there is that people don't need to be Northumberland residents, they just need to be in Northumberland, they could be visiting. And we're really clear that when people present with mental health crisis or distress, it's a self-defined mental health crisis, so we're not applying any sort of clinical assessment or restrictions, and saying to somebody that they're not in crisis. We recognise that people describe those experiences differently. It's a 365-day-a-year service, open from 2 till 10 p.m. every day, and it offers support either in person, so people can walk in off the street, they can call us by telephone. And since launch, we've offered virtual appointments, so people will be able to phone up and arrange a virtual appointment where we'd send them a link to a Microsoft Teams meeting. This week, actually, we've launched a virtual appointments booking option on our website. So the Safe Haven has its own page on the everyturn.org website, and people can directly book an appointment to speak to someone from the Safe Haven. I'll talk a little bit about that on the next slide, but I'm really excited because it was such a key part of the brief as we went through the work with the steering group. There's a couple of attached digital options. James mentioned Couth and Quell. We know that those were already commissioned, but we've also commissioned Shout Crisis text line. So if people are experiencing crisis but they don't actually want to engage with the Safe Haven in any way, they don't want to call or walk in or book a virtual appointment, they could receive mental health crisis support by text message by texting EveryTurn to 85258. And the really important thing was that this is an open access service, so people don't need to be referred, but we do welcome referrals from professionals and partner agencies all over the county. The great benefit of that is that it's easy for people to access, but also that when people come into contact with other professionals elsewhere in the system, professionals can share information with us, which is great. Attached to that, just as a kind of a side note, EveryTurn are going to be the first VCSE organisation in the North East to have access to the Great North Care Record, and Northumberland Safe Haven is going to be one of the first pilot sites where we'll launch that in. So the major benefit of that is that our staff will be able to access, have limited access to kind of mental health records, which exist within CNTW, primary care records, and others from North East Ambulance Service. And I think social care reports some in as well. So that's a great step forward for us in terms of interoperability and just access to information when we need it. So the pathway, the service, as I've described, can be attended in person, so someone can just walk in off the street. There is a brief assessment at the door just to check that the person's safe to enter, and that will particularly consider if somebody is, say, highly intoxicated, or they might be carrying something that they could harm themselves or other people with. But assuming that somebody is safe to enter and wouldn't pose any concerns to other visitors or staff, they can walk in off the street after that kind of initial screen. They can call directly by telephone, and they can request support. We can offer support over the phone, or we can support the person to access the Safe Haven in person or using the virtual appointment booking function. And like I said, people can book an appointment on the website. The big thing with the virtual appointment pathway was that it needed to feel the same in principle. The experience needed to feel the same as if the person walked through the door. And I think we've got as close to that as we possibly could. So I'll just describe it very briefly. When people book a virtual appointment on the website, they receive automated text messages after they're booked. The text message will tell them what time their appointment is. It'll give them a Teams link. They don't need to download an app, so they can tap on the Teams link and it'll take them straight through to a web browser on any internet connected device. Doesn't need to be a phone, doesn't need to be a laptop. It could be a tablet, it could be kind of anything. And the text message will also include a link to a pre-appointment information form. So that form is the same as the form we use in person. The questions are all the same. And effectively, people, whether they attend in person or book the virtual appointment, are asked to rate their experience of mental health crisis on a sliding scale, a 1 to 10 scale, but each point on the 1 to 10 scale has a statement attached to it. So it ranges from I'm not in crisis at all and I don't need any support to I'm in crisis and I don't know how to keep myself safe, with a number of statements in between. The other thing they're asked to do is to identify up to 3 goals for their attendance at the Safe Haven, and that uses a nationally recommended outcome measurement tool called Goal-Based Outcomes. So that's an NHS England recommended tool for community mental health services. So people identify 3 goals completely personal to them, and then the rate each of those 3 goals on the 1 to 10 scale to where 10 is that they've completely achieved the goal and 1 is they haven't achieved it at all. As you'd imagine, most people would report for the thing that's making them seek out support for a mental health crisis. Most people report that they really feel quite stuck around those goals. The wider digital offer I've already explained, but when somebody comes to the door or books the virtual appointment, they'll have that initial assessment, and then they'll move into one-to-one support with one of our trained mental health support workers. So we've got a mixture of staff working in the Safe Haven on any given day. In person, we have a meet and greeter, somebody who just greets people as they walk through the door. We also have mental health support workers and senior mental health support workers. So the mental health support workers as a group will offer people one-to-one support. In person, people can choose not to access a one-to-one support session. Most people do, as you would imagine, but some people might just want a safe space to sit, to be away from whatever's going on in their life, and it might be that we're planned that from the beginning that some people might attend the Safe Haven a few times before actually accessing that one-to-one support session. Most people do, and what we'll find is that those one-to-one sessions have been really focused on de-escalating the person's experience of crisis, really looking to validate their experience and understand what's brought them to that experience of crisis or distress, and then developing an immediate safety plan and an ongoing wellness and recovery action plan. So that's really focused on thinking about the things that lead a person to experience distress or crisis, but then also think about the things that keep them safe. So it's very strengths-based. It isn't just about thinking about crisis and people being kind of stuck in despair, but thinking about the things that really do keep them well. And all of the one-to-one support is really focused on what the person needs, so what ongoing support they might need. We recognise that the Safe Haven might be a service that somebody only comes to once. It might also be one that someone comes to a number of times on their own recovery journey. So the really important piece of work that comes from that one-to-one session is thinking about the ongoing support the person needs. Now, for some people, and you'll see that at the bottom of this diagram, that they have an urgent or emergency need that the Safe Haven isn't able to meet. So that could be that they've harmed themselves, they've done something to harm themselves, or they have a kind of an urgent social need that our team aren't able to kind of immediately meet. So what we recognise is that in some cases people do need to have their needs met by emergency services, and we'll make those referrals when we need to. That might include referring directly into the crisis team, and we've got a really good relationship with Northumberland North Tyneside crisis team, which I'm very grateful for. Calling an ambulance if we need to, or making referrals into social care. We do have some data from the first 3 months, which I'll be able to share with you after this meeting, absolutely, just around what we've done in terms of escalation. There have been cases where people have needed to have their needs met elsewhere, but on the whole, most people engage with one-to-one support and are referred safely into other ongoing support services. Now, the main one, just to be clear, we deliver this service Together in a Crisis, is a 12-week mental health crisis support service, which offers one-to-one ongoing support with a named key worker and helps people resolve their experiences of crisis, and particularly the things that are contributing to it, especially where they're social. So often we'll see people in Together in a Crisis who have got housing needs, employment needs, relationship issues, but often just feel disconnected from the community and the other services that are available to them. So one of the great benefits of the Safe Haven is that we're able to offer a direct pathway and route into that ongoing support from a key worker. And one of the other major benefits is that some of the staff who work in the Safe Haven also working Together in a Crisis, so they kind of work across both teams, which is great. I've talked about Northumberland Recovery College, which we offer. So Northumberland Recovery College, we're very proud of, but it's commissioned by Jane and her team in the ICB, and offers a range of different recovery activities. and classes for people who are maybe further along in the recovery journey, so not necessarily directly in crisis, but would benefit from some kind of additional support or additional activities or experiences that just build their recovery toolkit. So that's attached to the work we also do with the Northumberland Mental Health VCSE Alliance, and lots of the sessions are delivered by grassroots local organisations that do fantastic work. And we can talk about that maybe another time, but the Recovery College is a massive asset, and it's great to be able to offer people access to the support. Jane touched on some of the wider system partners, particularly statutory services. I've talked about the crisis team, but we've also got really good links with NHS Taught Therapies, and increasing broadening links with primary care services. So the idea there is that some people do require clinical responses from clinical teams and maybe need something much more therapeutic than the Safe Haven's able to offer, but we can make referrals directly into those services. And obviously primary care includes GPs and medical support, but also the mental health practitioners working in GP practices provided by CNTW. And then there's the wider VCSE network, so we'll refer and signpost people into wider support as they need it. So monitoring and measurement, from the beginning of this, we've thought really carefully about how we might measure impact. Some of those are at a service level, but also at a system level. So the work we've done with Jane and the rest of the steering group has really thought about kind of how, this is initially a kind of a 12-month pilot. We want to learn from this service, hopefully for it to continue and for it to be really impactful. And I think some of the early data shows that it has been, so that we recognise that we really need to collect that data. So at a service level, we're thinking about demographics and how referrals are being sourced, particularly if they're coming from professionals or if people are just self-referring and walking in off the street. We really do want to think about the different types of support and routes into the service that we offer. So we're measuring that, and then thinking about what people move on to. Use of transport is an interesting one, actually. So we've got a contract with a local taxi company to be able to support people to travel to and from the Safe Haven, where they may otherwise be unable to. So we're measuring the total use of transport as we go through the first year. And I talked about those individual service user level outcomes. So the crisis scale and the goal-based outcomes have been really valuable for us for kind of measuring immediate impact. And then naturally, as with any service, we'll be thinking about incidents, feedback from the team particularly, and feedback from people who use the service. At a system level, what we recognise as an alternative to crisis service, it's really important that we're thinking about how the Safe Haven existing and offering support impacts on the demands in the wider system. So some of the measures we've talked about are say referrals into the crisis team and psychiatric liaison team based at Cronlton Hospital. Any impacts on emergency department attendants, any impacts on police or ambulance crews, and then I guess wider impact on social care. That was a really important one, as we've talked to the social care teams in the council, and then any wider impacts on the voluntary sector. And I'll say, coming from the voluntary sector, we often hear when there's a new service, then the sector worries about the potential impact on their capacity. So we've thought about that really carefully. So final slide, and then we open to questions. Just want to think about what helped. It was really important to us, like lots of us within the steering group, that this service happened, and it was a long piece of work, and I think felt at risk at different points for lots of reasons. What really helped was the steering group feeling committed to the partnership. It was so important. It was great to meet with everybody so regularly and then think about how we would solve this problem together. So we had a clear vision and a real commitment to Northumberland residents and understanding Northumberland's needs. It attached quite nicely to the wider work that Jane and her team led on community mental health transformation, and the principles of that, you know, thinking about joining up systems and using the voluntary sector alongside statutory services. And really helped us to have perspective on everything that was going on in the system. You know, Jane touched on it, but it's kind of crazy, really, when you think about it, that we're setting up this kind of brand new service alongside the ICB being established and going through change itself, alongside the implementation of Right Care, Right Person, alongside the implementation of 111 option 2. It's mad that we've done all of these things all at once. So it's been great to kind of think about that perspective. We've been able to challenge each other really respectfully, and particularly challenge other areas of the system to be able to kind of move this forward. You know, there's naturally been blockers because of the work we've had to do around capital funding. You know, the capital funding was a big part of this happening, having a big pot of money to be able to refurbish a space, but actually we had to negotiate with the ICB at different levels how that capital money moves through the system, because it's just it was a different way of doing things. You know, really had to be optimistic. I felt very optimistic throughout this, but it's been challenging, and being tenacious. You know, Jane particularly has been very tenacious, and I know Wendy, you've been super committed to this and have really helped drive it forward. So, you know, it's fantastic to be here and to be able to talk about it. So, would like to open up the questions. I'll stop sharing my screen.
Thank you, Jane. Thank you, Pasha. It's really a good presentation. It's not only just a presentation style, but the contents. I mean, it's a great idea that has been implemented with thoughtful thinking and planning. It comes through, and a comprehensive design considering all the factors, including measures to measure the progress and impact, and so we can learn for the future. Wonderful. Are there any questions for, yes, Wendy?
Thank you very much, Chairman. Excuse me. Pasha and Jane, that was wonderful. Thank you so much. I would like to ask, and I know it's only 3 months old, but I would like to ask, how many people are attending? Are they coming off the street, or is it mainly online? That would interest me greatly.
Yeah, so I think what I would caveat all of this with is, with a brand new service in a brand new place, what we've expected is that referrals would increase month on month. In total, the Safe Haven supported 158 attendees over the first 3 months. That breaks down into 27 in the first month, 43 in the second, and then 88 in month 3, June, just gone. It's been, you know, that's as expected for me. I really did expect that we would see a kind of gradual build as people become aware of the service, and particularly as system partners become more aware of it and trust it as a place to refer people into. But it's great to see that we've had that improvement. Most people self-refer, so it's about 68% of people self-referred in the first 3 months. And we see lots of signposts and referrals, particularly from the crisis team and psychiatric liaison teams. We're seeing a lot of signposts from Northumbria Police, which is great, like really, really good that we've been able to get the service on theirs and the North East Ambulance Services app. I'll have to come back to you with data on the route by which people have accessed support, but what I do know is that people have accessed I think virtual appointments have been more popular than I'd anticipated, I would say, in the first 3 months, but I'm more than happy to send some data across to you, Wendy, and to the board.
Thank you very much. Thank you.
If I can just add, Wendy, we're seeing at the moment there's a slightly higher percentage of men attending the Safe Haven, which is really encouraging, because we know that men don't always approach services, and I just wonder if it is because there is an opportunity, it is so accessible, so that, you know, people can contact the Safe Haven when they're actually, you know, in the middle of that crisis. And I wonder if maybe that it, you know, the way that it responds means it better meets the needs of men. But certainly we're seeing a higher percentage of men accessing the service at the moment.
Do you know, that's wonderful, because you're so right, men don't come forward. I'm absolutely delighted to hear that, Jane. Thank you both so much. Really appreciate it.
No, thank you very much, Jane Pasha and Councillor Wendy Patson. I think that was really, really positive. Such a wonderful thing you're doing for those in crisis with mental health in Northumberland. From a police perspective, it's not a question really, but more a comment. Just to say it's really welcome. You know, we know people in mental health crisis ring the police a lot, and the Right Care, Right Person, which you have identified as part of the partners you've worked with, is really positive. And a positive question again around the numbers attending and increasing month on month. I think there's more we can do to raise awareness, because I know it's well known within the local team in Ashington, but we need to broaden that. And then on the point of the location, I think another positive step, you mentioned the buses, but we've also got the railway line that's going to be coming in through, which is going to bring greater connectivity across southeast Northumberland. So that'll be really, really positive. And I will visit Pasha. Thank you very much. I'm going to make a plan to come across as soon as possible and make sure that message is passed out around the referral so thank you very much.
I wonder if I can come in just very briefly. There's just one thing I would like to add, and that is some of the community links that are happening with the Safe Haven and really sort of extending out to the community. And one of the groups that I find really interesting is the Cuppa with a Copper. And it's a weekly meeting that takes place in the Safe Haven where local community police come in and talk to a whole range of different professionals and local people about difficulties that they may be experiencing in their area. And I just think that is such a lovely way of breaking down boundaries, breaking down barriers, you know, with statutory services like the police and the local community. So I just think that the Safe Haven's really trying hard to really immerse itself into the community in that way. It's just one of the really good examples of things that are happening.
Thank you, Jane. Thank you. Jeff, please.
Yeah, I was thinking about the geography of Northumberland, which you talked about earlier, and the difficulty of making this offer available to all residents. And I'm wondering if community hubs that we have sound to me as though in many ways they are similar, and I'm wondering if they could be utilised. I mean, I think you said yourself, some people just want a safe place to sit. Well, that's exactly what community hubs are. And the sort of number of people that we're talking about using this service isn't going to be an issue or a problem to our community hubs. And I just wondered if that was something that we could consider in the way of expanding it out. Because to my knowledge, people in, I don't know, Cramlington wouldn't go to Ashington to walk off the street to a hub, I think. And I don't think they would from Alnwick, and certainly not from Berwick. So I just wonder if the use of community hubs may be something that we can make more use of.
It's a good idea, so let Jill take over.
I'll come in first, Jane, if that's okay. And just in relation to Jeff's comment, I think this is all about the stepping stones in relation to support. So what Pasha has described is some very specialist skills in a soft setting that are actually taking place within the Safe Haven. So when Pasha described that pathway and being able to do that assessment of need, that's quite specialist skill set in a community environment. What can happen before that potentially is the utilisation of community hubs and the way that we are evolving our workforce, as you know, Councillor Watson, to be able to better have a holistic conversation with our community members when they walk through the door. So I think there is absolutely further opportunity to connect community hubs with the Safe Haven philosophy. But for me, unless Jane tells me otherwise, the Safe Haven is relatively specialist, even though it's a non-clinical environment.
I think, if I may supplement your answer, I think I see two models. One is to replicate, like if this safe haven is successful in Ashington, should we think about replicating across community hubs, or funneling model where we enlarge the safe haven, but use the hubs to point to people to go to Bothie in Ashington. So there are two different models. So how we go forward, I think I'm not really sure, but time will be the answer. Yeah, Jane, you want to come in?
Yeah, if that's okay. Jill's absolutely right in the way that she described the safe haven. I thought that was a perfect explanation. What I did want to add is that through our community mental health transformation work, we're working really closely with the local authorities and communities together, and the Prevent strategy to bring together a variety of different services, and so that we work in a collaborative way into those community hubs, because you're absolutely right, we have some fantastic resource available now across those hubs in Northumberland, and so we're looking at how we can collaboratively get together and make best use of those. And one of the things that we're looking at as an adjunct to that is the use of those mobile vans that we have available for Northumberland, of which there are 3. So we're looking at some really creative ways of kind of ensuring that wherever anybody lives in Northumberland, if that means that we drive a van once a week out to that area, and that van offers a whole range of different options and accesses to different services, then we can do things that way. So that work is ongoing, and we have a workshop planned in August to really start to gather some momentum and think about what it is we want to achieve through that. So those conversations are happening.
Want to come back on this? No. Press the mic, please. Yeah, thank you.
Sorry. Pastor Jane, Wendy, thank you for that presentation. It's been really interesting and exciting to hear about the developments in Northumberland. And I know North Tyneside would be very envious to actually hear, so I think it's been really helpful. Just a couple of points from me in relation to, you talked about system impact, and I was just wondering how we're going to monitor actually, is some of the need for this service because of the pressure on other parts of the system, so because of the waiting list for talking therapists, etc. Are we capturing that in any sort of way? Or is that possible to do that? I think around that pressure on the system. The other thing I was wondering as well about is the capacity of the service. So I get we're sort of just starting the numbers, we expect the numbers to increase, but actually how are we ensuring that capacity is there to meet need as well within the safe haven? And the last point is in relation to how is it publicised? How are people aware that the safe haven exists? I know obviously there's a lot of partners involved, but from other parts of the community, just got a colleague sat next to me who's a pharmacist who's saying that they're not aware of the safe haven, and people obviously do often walk off the street into pharmacies and other venues where they may be able to be directed into the safe haven. I guess there is something about how we manage capacity as well, about you don't want to be overwhelmed, but I guess it's just understanding sort of your thoughts around that. Sorry, I've asked lots of things.
That's okay. I think I can answer most of it, and Jane might want to come in particularly on the system impact. So in terms of capacity, the safe haven's really well staffed actually. We've been blessed in lots of ways by a really healthy revenue budget to be able to deliver the service. So most nights, the Safe Haven should have 4 staff working between 2 till 10 p.m. every night. In addition to that, the meter greeter is also there as on some nights to be able to add a little bit of additional capacity. Now, we'll have to make decisions around how that workforce is used, and naturally you've got to think about the safe management of the space, but it does have a pretty healthy staff team and should be able to support quite a large capacity over the course of a year. I think, you know, in general, I'd modelled for the idea that you would want to support up to 2,000 people a year within the space. Naturally, that we're not there yet, but that what that would suggest is that you'd be expecting at least between 6 and 7 people a day visiting the service, either virtually, in person, or contacting. In terms of promotion, I'm sorry to hear that the pharmacies aren't aware. What I will say is that in the last 6 weeks, we've been doing a really focused effort on engaging system partners, and that's included some of the kind of core system partners we've talked about in the presentation, but also other kind of wider partners. I'll let the team know that we need to do a better job with engaging pharmacies, and there is some work that we've done in some of our other areas. Just as an aside, of Return Deliver services nationally, there's some work some really good work we've done with pharmacies, particularly to improve access to talk and therapy services, as an example. So I'd be more than happy for us to kind of focus on that area. So the initial work has been on in promotion, has been promoting the service to system partners to improve referrals, and really to understand, like, I think I understand, I've got a kind of a recognition that it takes quite a bit of work and a bit of time to change the referral habits of professionals working across systems. And I'll say that, having come from CNTW and crisis services particularly, I recognise that crisis teams and clinicians often refer to kind of similar places because they know and trust them. So we've needed in the short term to build up the Safe Haven as a kind of trusted resource for system partners to refer into. What we've noticed, though, is that most of the referrals are self-referrals, so people walking in off the street. Phase 2 of the work that we're going to be doing is really focusing on advertising the service much more directly. So we're able to be really flexible with using things like social media ads, targeted social media ads, which are particularly geo-targeted, and we'll work really closely with a PR and marketing agency to kind of improve access and awareness of our services. So that's absolutely part of the plan, and I'm glad you've raised it, Janet, because we would look to do the same in North Tyneside too.
Jane, would you like to add anything, or can I move on?
Just thank you. Just very briefly, just to add that our ICB have also been involved in terms of the publicity around the Safe Haven. So we've had national coverage as well. On media, on national media and local radio stations and TV as well. But appreciate what Pasha says. That was a couple of months ago now, and I think it's an ongoing piece of work in terms of marketing and using all of the different avenues that we have available to us to ensure that the Safe Haven is well understood. We're doing a workshop in October of this year with primary care to talk about not just our community mental health transformation, but those services associated with it. And the Safe Haven is obviously a major player there. So we'll also be promoting, again, with primary care directly, the role of the Safe Haven. So we hope that will certainly help to broaden the level of understanding and awareness of the service. And in terms of impact on the wider system, we talked a lot about this in the steering group. We talked about how could we capture where the Safe Havens had an impact, say for instance with Northumbria Healthcare and people inappropriately sitting in the emergency department with identifying with a crisis that wouldn't meet a secondary care sort of crisis team criteria. And this has been really tricky, I'll be honest with you, because in terms of sort of systems actually being able to record that in their existing kind of electronic systems has proved to be really difficult. So for us at the moment, it's about that steering group providing us with the sort of anecdotal kind of evidence. It's about every turn, wherever they possibly can, having an understanding of where somebody's come from if they've not necessarily been referred, and if they've come in through whatever, access route to the safe haven, where had they been before? Maybe what hasn't worked before for them as well. And so I think that we can start to pull together that sort of intelligence through a number of different routes, but we have to be creative about it. We can't rely on kind of traditional data methods, if you like, with a new service like this, and the complexity of our wider systems wherever we are, whether we're in Northumberland, Newcastle, North Tyneside. Hope that helps.
Thank you. Graham, please.
Yeah, thank you. Hi, thank you, Pasha and Jane. It's Graham Binning here, the Chief Fire Officer at the Fire and Rescue Service. If I go back to April when we had the Inequalities Showcase event, I think everything that we're talking about here is everything that this needs to be a part of, and we have to understand where our community connectors exist. To take Jill's point there about what does the collective network learn to be able to know where resources and signposting can happen. We had a meeting before we came into Health and Wellbeing Board today. We talked about signposting, who knows what, where are the interventions happening, and where are specialist generalists going into situations and being able to signpost individuals potentially in crisis. One thing I'll take away to have a look at is whether we can add a link to the hub, the Bothy, into our Fire and Rescue Service website. Kevin and I will take that away as well. I'd like to peel back to understand, is this being seen as a tactical option at the MASH, the Multi-Agency Safeguarding Hub, to make sure that we connect that in. So going back to the Inequalities event, we all wrote postcards to the future. What did we want to do? We wanted to know where all the things were happening that we maybe didn't know back in April. This is one of those. So the fact that we can sit at this Health and Wellbeing Board and say, actually, I didn't know that this was happening, that should be seen as an asset. That should be seen as a positive, and the Health and Wellbeing Board serving its purpose in that case.
Hiya, Pasha. Nice to see you. Great service, much needed, and I'm pleased it's in Ashton. Can I ask you a little bit more about the staff and rules, and a little bit about what's in place to keep the staff safe? Because you did say there might be people knocking on the door that's drunk or intoxicated or with weapons. Can you give us a little bit more on that, please?
Absolutely. Yeah, great to see you, Mark. Yeah. So the staff team is made up of mental health support workers and senior mental health support workers. There's a meet and greet, and we also have a team lead who works across the safe haven and together in a crisis directly. The workforce, as with any of our teams, is made up of people with a kind of a mix of backgrounds. Some people have got a real interest in mental health. Some people have got lived experience of mental health difficulties, but we're very clear that these are kind of well-trained mental health support work roles, and some people might bring in the experiences with them. The team, I will say, just on a kind of personal level, the team are really super committed to this service, and have been really enthusiastic about setting up a new service and owning it. And one of my great joys in developing the service from an every term perspective was to be able to hand something over to a team of people who are so enthusiastic to kind of manage it. From a safety perspective, and you're right to ask, Mark, actually, because we've thought about this quite a lot. The building has CCTV throughout, and that obviously kind of helps with post-incident support. All of the services, all of the staff have access to lone worker devices. Those are attached to, it's all through an app on the phone, but they have a panic alarm on the lanyard, which they wear at all times. They can use that while they're travelling to and from the building as well, so it's not not only, you know, they could use it kind of whenever if they feel unsafe kind of travelling back to the car or on public transport. That lone worker solution is not unlike the solutions used in CNTW and other organisations. So it goes through, if someone presses the panic alarm, it goes through to a central support team where they will listen in to an incident and make a decision, an informed decision about whether to contact the police or any other emergency services. Additionally, the team has built into a kind of a budgeting system to, you know, people do travel to and from the building together, specifically late at night, you know, closes at 10 o'clock. But we've been really keen to kind of review incidents within all of that and take feedback from the team about how safe they feel working there. We haven't had any kind of complaints around that, and I think there's a kind of recognition that when you're supporting people in mental health crisis, often things may feel unsafe, but we're really keen organisationally. Every turn is really committed to making this a good place to work for people, and in fact, you know, have really kind of invested in listening to teams around their experiences.
Can I just come back quickly? Thanks, Pasha, and I would also like to come and visit and meet up with you if that's okay.
Love to have you, Mark. Yes, it would be great to see you.
Cheers. Thank you.
All right.
Problem to visit there, Mark. No, I'm joking. Okay. So can you please say something about wind it up, Jill, please? Yeah.
Absolutely. I'm mindful we've spent an awful lot of time on this agenda item, and that just shows the passion and commitment that we've got to this topic area. We have got into operational detail, which is quite unusual for us as a strategic board, but actually, again, I think that shows the level of commitment that we have to making sure that we can support this working. So huge thanks to Jane and Pasha for the level of detail. If I may ask the board and the chair, it would probably be of interest for us in 6 months' time to see some of that data coming back in relation to the demographics in particular, so that we are seeing that stretch beyond Ashington, and also are the connections that we are highlighting here now operational in that 6 month period. So I think that's something, if you'd be willing to agree, Chair, that we could agenda.
Yes.
So that would be helpful. And also, I think I hear your points, Jane, around how hard it is to measure prevention, and actually the ability to articulate powerful case studies. And we talk a lot about stories in our inequalities work because the statistics take a long time to change, but actually the power of stories can't be underestimated. So again, alongside the demographic data, some powerful case studies would be really well received. So thank you.
Thank you. Do you want to say something, Rodney?
Yeah, thanks for that, Chair. If I could add on to what Jill's saying as well about a wider lessons learnt, after probably a 6 month period, I'll be interested in having a separate conversation about accommodation requirements and whether the building has been found to be fit for purpose, and if there are any lessons about actual layout of buildings and physical requirements. Thanks.
Will summarize. I mean, when I came into the meeting, one of the things that worried me was are we raising enough awareness? So I was talking to Claire to confirm whether council itself has publicized it. But I'm very glad that that point was raised and discussed, and Kevin and Janet was also saying the same thing, and Graham, they have volunteered to publicize it in their own work environments. That's good. And it's nice to hear that the healthy revenue budget, that's what Pasha said, so I'm very pleased about that one. I mean, so far it looks like 55 persons per month have approached the BOTI, if the statistics go by, per month in the 3 months. So you said 158, so it roughly comes to 55 per month, so that's a real good story. And as we raise awareness, we need to also think about, it is likely to become a very successful story. So we need to think about how we are going to meet the extra demands, whether it's a replication or scaling up in Ashington. So this is something we need to think about as well as a board for the long term. Finally, I think visiting is a very good idea, Mark. I think I would like to see it myself as a, health and well-being board. So I'm just wondering whether our visit will disturb you a lot. That's something I'm very conscious about, coming there to looking at the body. So if that is okay with you, Pasha and Jane, so we might, come and visit and see how things go. Yeah. Thank you. Thank you very much. Any other question? Okay, thank you, Jane, and thank you, Pasha, for making this presentation, for all the efforts you put in, and answering all our questions. Thank you very much. Right.
Thank you for having us.
Bye.
Bye-bye.
Thank you.
So the next major item is Thriving Together, update from Emma Richardson, and Councillor Veronica Jones will be making the veteran of VCSE liaison. So I am very pleased to see Veronica introducing this part of her brainchild.
So as an introduction, I really just want to do a very brief background to the Thriving Together. 3 years ago in 2021, we commissioned, as part of our contract with the CAB, we commissioned Thriving Together to work to support and build capacity in the voluntary sector. The idea was to work across the whole county, to give support directly to even the smallest of clubs and groups, to help them grow, to be financially sustainable, and to have the governance in place that they really needed. That was the brief. Emma's here. I understand Abby's not able to come, so Emma is going to just tell us how they've worked to achieve that in giving the annual impact report. That's all I want to say. Thank you, Emma.
Thank you. Yes, so to be clear, not my report, but as everybody knows, I work very closely with Thriving Together and in the wider community. And we've heard this morning how important it is to work with and in our communities, but also to have confidence in the way they work and for us to understand, because we're very different, aren't we? And the key role of having a VCSE support contract is, one, it's an enabler, because there's a quality assurance for them to access other funding and investment, which we'll cover, but also for us to feel confident in the relationships we build and the work that we do together as different organisations and different approaches. So as Councillor Jones says, the report I have here, and I think it was Abby's intention to bring hard copies, we will make sure, I think they're in the note, we got some, great. And I was fortunate to be at the launch of it yesterday, which was a really interesting session in that they'd invited a wide mixed sector partner, including the voluntary sector, to comment on how they felt the contract was working for them, for us, for all of us, and also to give suggestions going forward, because this work takes a long time as we keep going back to what have we seen, what would we like to see more of, and what are we learning. And so even though I am reporting on them with the best will in the world, I'm very good at giving my own opinions, so I'm talking to the report, but some of it will be mine through that. So they've had the contract for that time, and it is about building capacity, building those relationships, and really getting the best out of our collaborative working together. And over the course of that, of course, we've got the inequalities, 3 core questions: what can communities do for themselves, what do they need our help with, and we figure those out by having these conversations together. So the core mission, as stated in their report, making sure the smallest voice in the third sector is heard and building the capacity. Just to go back to that first point, making sure the smallest voice, really important for Northumberland. I worked in Glasgow before this. We had lots of big organisations, high presence, easy to pop along to a meeting. It's very different geography in Northumberland, a lot of small organisations, but actually that are doing incredibly valuable work a week, whether it's from 2 till 10 p.m. every day of the year, or whether it's from 3 till 4 once a week with a well-being group. So that's constantly working to hear and listen, and the only way we can do that is through collaboration, and you can see there's a comment on the front from the chair around collaboration. I mentioned that the contract is an enabler. You can see when you look at the staff team, the value of this contract over the 3 years is £300,000. clearly that's a big team and a lot of value for money. The reason it works is because pulling together and seeing what else are we doing, what else is contributing to this, because Thriving Together is an entity and a way of working. It isn't about one organisation. It's actually made up of lots of different pieces of work, lots of different, and held and choreographed and shaped and directed by Thriving Together in their wider strategic positioning. They work with umbrella partnerships, and it's about relationships, as I say, and sharing knowledge and best practice. These are all really soft kind of language and landing points for that report. And as it goes through, you start to see the build of the numbers, which ultimately are really important because our voluntary sector rely a lot on funding from elsewhere. And a big part of our work is sharing our challenges so that they can articulate challenges and solutions to bring that investment into Northumberland. And that works with, as I said, relationship and knowledge share, not just across the voluntary sector itself, but across all of the sectors. And that reach and networks and insistence that stays dynamic, that door is open, that the kettle is on, or that we work to go and visit each other's sites to understand so that we're continually developing. In the next session, they go on to talk about the communication methods. Always key, but email is not only the answer, and newsletters, and we don't always have time, so there's lots of different ways of communication. And listening yesterday to the comments from that around how that works, you can see they've got the web page, which is very well visited, 14,000 views in that period, but they also have all the other main Instagram, LinkedIn. I'm showing my lack of social media knowledge and so on. And they use the, you know, and if you look at it, they are interactive and colourful and reciprocal. And that's really important for other reasons we'll come on to as we go through the report. The networking events, if you haven't been to one, I would absolutely suggest you do. When they first mentioned to me they were planning to do networking events without agendas, so they would just literally say, come and let's have a conversation and we'll see what... And I thought, how is that going to work? Actually, it works tremendously well, especially if we, you know, these days we've got packed calendars and the 5 minutes that you want to have a chat and say, what is it you say you were doing in Ashington in the Bothy? Tell me about that. You don't get time, and what this really does is put a bit of elbow room in the week, but with some really skilled connecting by Thriving Together and the community connectors. Have you met such and such? Have you met this? What we're seeing from them is the shared resources, the shared opportunities, and that real collective approach rather than a silo way. So, you know, for example, things like in my head, Children and Young People's Network just came through this morning, so I had a little look at that agenda. And the training for that, well, food hygiene and all of these other bits, they don't necessarily think attending a Children and Young People's Network would be for them. But being in a network, oh, Joe, we're really struggling to find how do we can, and that work then happens, and it means it happens at pace, and it gives us best value. The example I always give is the, you know, the balloon that children play and they bounce the teddies on and things. At one point, I think we had 36 in Northumberland, you know, when we were doing the holiday provision, and actually we can share them around a place, and that gives us best value for activity-based funding, and these little things make huge differences in and with our communities. So the networks are fundamental. I've mentioned the community connectors, and on page 4 of the report, across Northumberland, really important in this kind of work that there's visibility, and a core part of this contract is, one, ambassadors for the work that we are all committed to, because we are all committed to this work. You know, we are a shared workforce, and pushing forward into the shared competencies, things we can all talk about. It's really important that those messages are travelling across the county, and the community connectors, as they're out and about doing the job of, can you come and help us maybe understand how we can get funding? Can you help us with this policy? And all of those functional bits and pieces, but they always carry that other strategic knowledge as well, because we've positioned this contract to have that understanding and knowledge and part of how we design it, and taking it in, so we then have involvement from all kinds of different organisations in our bigger strategies, because these are our people in our workforces and our resources, let's face it as well. And that includes, of course, frontline and ensuring that even the smaller organisations are visible on there. So just as we've mentioned with police and fire and the Bothy, that signposting on is easy to find, but also locally relevant to people who live where they live and may not want to travel far and wide. So you can see the value of it, a lot of one-to-one support, a lot of visiting, a lot of networking, attending, but also a lot of carrying knowledge. I always picture them in my head. I'm so visual, but with backpacks on, you know, and what are they packing their backpacks with frontline, with information of what fire and rescue are doing, with bits about the inequalities plan and storytelling to continue this work. And there's loads of gorgeous pictures in this report, isn't there? In amongst that, it's also really important that this work is targeted to be meaningful for impact. There's lots of things that are lovely to have, but there are things we really need. And you can see when we start talking about the added value, and we talk about governance support and that robust community partnership, there are some partners we absolutely need to lean on and be relying on, and we want to be confident, one, where we're investing, whether it's through commissioning or partnership approaches or whatever, but also that you know, that they're working with us and that we're kind of moving forward together. So there's two really good case studies in there. The Northern Cancer Voices, which wanted to become more than just a kind of functioning group and to move forward, and they had an opportunity. And Thriving Together, we were able to put a temporary governance sort of structure around them as they, rather than business interruption, which allowed that really important work to continue on. And similarly, Hearst Welfare in Ashington, there was a transition through a community asset transfer, well, kind of complicated in terms of the ownership. It was a complicated picture, but a really important part of that community that had so much life in it and was so loved and wanted to be, as they went through this transition, protecting it. So Thriving Together were able to temporarily recruit the centre manager that allowed the governance around that to get their work in order, to be ready to take that staff fully on board, which meant our investment as a local authority was safe, but also meant we were able to draw from our mixed expertise, whether it be our early years, leaning in to help with the nursery and all, just how are we thriving together. So pulling it just from, you know, Abby, Nicola and that team on the front, but who else do we know and who else are we connecting with that can really ensure we get the best out of these decisions that we're making together. Because of all of this work and because of the connections, there's a word that I particularly love, which is readiness. We are ready to access opportunity. We are ready to bring investment to Northumberland for Northumberland and for Northumberland organisations and places. And there's some great examples within this around particularly some of the funding that Thriving Together have been able to lever in from the Combined Authority. I mentioned at the start that we in Northumberland, so many small organisations, going on a procurement framework is a really difficult and big piece of work, or we simply don't meet the financial threshold. So pulling together partnerships who know each other because they're spending time and doing little bits of resource sharing together and building that trust across the patch are ready to apply for these bigger amounts of funding, and the numbers for that are really quite impressive. They've gone on to talk specifically about the programmes, Solid Foundations, the employability project for those furthest from the labour market, the adult education budget, which is a really interesting model in Northumberland. They had their first Ofsted visit this year, which is, you know, and really local, small organisations working with people perhaps with learning difficulties or who are far removed from the labour market or come, you know, whatever reasoning it is, enabling community-led education to take part in place, but with the assurance of Ofsted as that is supported by, you know, this is really powerful. It's empowering for the individuals travelling on that path. It's empowering for the organisations, and it's empowering for us as a place in terms of our future workforce. And then Multiply, in terms of numeracy and literacy and millions of other things in lots of different ways, whether it's cooking, whether it's art, but and then recognising you've actually achieved a qualification at the end of it, and because of the connections, there's a next step. And this is really interesting work. And when Ofsted came to review the programming, one of the things, because it's difficult and we don't fit the model, and that, you know, it's an interesting conversation. And when you're pointing out this and you need this and can we look at that and so on, and Abby had said, should we be doing this? Are we in this space? And the senior inspector said, absolutely yes. And that, you know, that yes, okay, so it's hard, but they're in the right place with it, pulling people together where people are, just like we were talking about with the Bothy. Where people are is where we need to be best. And our community are there, so how do we figure out how we work that out in the joins? And they're really in that space for us. On page 10, there's a summary of the numbers. I mean, you know, the return on investment has been really quite impressive, but I think more important is that where that investment has gone, it hasn't come into Thriving Together as that entity, it's gone across the VCSE and across, not just the VCSE, across the right partners, because there are some private sector partners in there as well. Luck Productions is one of the examples that's given. So that's worth a little look at as well. And just that way of working, the transparency, the openness, the visibility and the opportunity. Is this for you? Raise your hand and come along and tell us what you're trying to do. As a local authority, I think this is my own reflection. It makes me say, look, this is what we are doing, and it's all of us. It feels like we, and I think that this contract is in no small way part of that. There's some lovely testimonials as well around how well it works. I haven't skipped past the DCS liaison, I haven't come to that yet. You can see, going forward onto page 13, you can see the reach. Really important. One of the biggest challenges was, oh, but you're never in this area. Oh, we don't see you there. And you can see over 399 connections in that space of time. And again, pulls through on their social media. So, you know, you might not have a social media and you did it, and they'll pull you through and talk about what you're doing and where you are and so on. And all of those different pieces of work. And it kind of undersells itself in lots of ways, because the connections that are there are individual, we've touched them, but actually the connection that comes from that touch would then look very different, and probably would have to zoom into a tiny little ward at a time to see that, because you can feel the energy between as these partnerships emerge. So I mentioned at the top that the networks, and I keep mentioning the word networks, and they are so important, aren't they, to know each other, spend time with each other in a meaningful way. And on page 14, you'll see the list of networks that Thriving Together either fund or pool together, because part of the contract investment they put out to fund networks so that they would have that reach. Some of these, there's always a bit of, well, why is it North Northumberland and why is the Seaton Valley? The reason is because the ask was made, have you got a network and would you like to be part of Thriving Together? And those are the networks that came forward. When I was at the event yesterday, there was a big part of the conversation was around what is it going to be for the networks next? What value how are they going to contribute? What is the role of the leadership in there? So we're all used to seeing Abby and Nicola around. What would it be like to see Andy Dean from Cannes, who's coming to the next VCS liaison? What would it be like to see Being Women Network? Or, how do we, so in that next phase of this, how do we pull that through to really form those relationships? And how then do they as network leads and keep their door dynamic and open, so they're continually reaching into their own communities of place or interest to ensure we're keeping that small voice listening and we are in touch with the real landscape of Northumberland. The networks are really, they are very different and they're interesting, but they cross-pollinate quite well as well, and they work away. But I think that's a one to watch to see, and what might we want from that? What might our ask? Or indeed, what's the call to action to us to be part of those networks? It's not just about sectors, it's about let's get this work done together under these themes. The VCS liaison, which Chair and Vice Chair are here with me, meets quarterly and is a co-set agenda. It's a strategic gateway point for the voluntary sector, elected members and the key officers to either talk through some issues, learn about what we're doing, or even just share some concerns or ideas or best practice. The agenda is set by the chair, by Thriving Together, and by the community who are contributing through all the ways we've just talked about what those priorities are, and myself as lead officers. And then we've got a core membership, but beyond that also inviting relevant representation from the voluntary sector, from health and from the council. So it's a mixed and noisy and lively session usually, but with good actions that come from it. Sometimes they're really small. One of the examples, again from my email this morning, we've been doing some work around leases where we've got voluntary organisations that are in some of our buildings, and our lease trigger point isn't always helpful to when those organisations can access funding, because sometimes if you've got the lease for this length of time before you can access funding from some of the big funders. So Blythe Valley CVS as part of Thriving Together, to make the point that it's always who's the best person to be doing that, has been working with our surveying team to see how can we do that works so that we're getting the best, but again particularly with mind of who is providing services and activities and programming that really lends itself to where we're pulling ourselves towards in terms of that place of great opportunities where everybody's doing well. So the prioritisation cuts across it as well. It was a really interesting meeting, and there is a separate report to that if anybody's interested. We could add that on to the minutes. Finally, the wider stakeholders. All of this relationship building takes up a lot of time, and Nicola has really helpfully on the back put the touch points in terms of the wider stakeholders that Thriving Together are frequently involved with, never mind the stuff that they attend on an ad hoc, and you can see there's a wealth of work in there. And for us, I think there's a real question of kind of how are we making best use of these opportunities to be working together? Is that the right way? Have we, you know, and actually what is our ask of them for next? What is our message out to the communities, and how do we continue to just understand how we take those collaborative approaches to get the best value, the soonest impact, and all of those lovely things that we search for? And I think, so in terms of the next steps from it, and going back from yesterday, I'd mentioned that maturity. We've come a long way in terms of making relationships across the voluntary sector themselves, from the local authority with health, and that's for all of us. That's a journey we've all been on. The leadership that we've got, the specialist knowledge that we've got, how are we really harnessing that, and how are we really building different little pockets of work that make sense to our shared ambitions, and making sure that we're continually developing together. This sense we're not doing two anymore, whether that's across our own directorates or whether it's across the voluntary sector. How do we keep that alive, and we don't say, oh, that's lovely, how do we just keep it going forward? That was a real noise from yesterday, a lot of positivity about the report, some clear steer around feedback loops and things like that, which they absolutely took on board. But I was saying to Jill earlier on, one of the lovely things was that Nicola from the stage rightly pushed that back and said, so what are we doing? What's our solution? How do we do that? Then let's pull together and think what that is, so we're all thinking the same things, and that's best value, really. So I hope I've done it justice, because it is a lovely report, and I hope you enjoy reading it.
Thank you very much, Emma. I think Thriving Together is a very productive and effective initiative. I've been with it since its inception in bringing together all the voluntary sector in our fight against inequality. Thank you very much for the presentation. It was lovely. So I'll open the floor for questions. Are there any questions? Yes, please.
Yeah, thank you, Chair. I mean, I'm fully behind this. I think Emma and Jill know that. I mean, I was here a couple of months ago presenting the adult social care position statement and conversation, and I think I made a fairly bold statement about this being the only game in town for us going forward in terms of surviving as public sector bodies, and it's enabling communities to help themselves. A lot of the narrative that you've used in the report there, though, was around attracting organisations into talking to us and then supporting them. I suppose from my point of view, I'm particularly interested in spotting gaps. I mean, we mentioned geography in the first part of the report around the safe haven, etc. And geography is a big thing here. We know we've got some fabulous pockets of voluntary sector work going on, and small community organisations that are supporting in their areas. I'm interested in the bits of the county that we haven't got that in, and trying to stimulate that. And I just wondered, in Thriving Together, is there an action plan that is doing a gaps analysis and then positively looking to try and, I mean, replicate models of good practice in some areas into other areas, which to me I think is the golden ticket in terms of solving the problems on a more equitable basis right across the geography of Northumberland. I'd be really interested in that part of it, which I don't think was covered as much in the presentation. So I don't know if we're at that yet or we're moving towards that. So, yeah.
It is, absolutely. And one of the things, going back to the VCS liaison, the daycare question was brought up by a member of the community, and what that resulted in was that a piece of work that's ongoing and due to come back in September around mapping where is it that we've got activities. So we know we've got the warm spaces, but really understanding what we've got, and the network, so the health and wellbeing network, and it's about tasking. Can you tell us more about that? And leaning into it, of course, not just asking them to do it on their own. So yes, and that's just what we need it to do. how do we figure that out together? So absolutely, and it'd be interesting to see that report come back to the VCS liaison, and we'll share that on, and then what would we want to do from that and with that, because they do, when we did the warm spaces session, specifically invited people who were in the less populated areas where we knew less dense activities and programming, and it was such a positive session, and the willingness to work with us, and they recognise the challenge and share the challenge as well, Neil. So I think it's absolutely what it's there for, and that's that prioritisation. This is a core priority for us. Let's see how we figure it out. So yeah.
Do you want to come in?
Yeah, thank you. Just to build on that and to echo Neil's comments, I think they're really valid. And for those of you who may not know, we're coming to the end of our first 3 years of Thriving Together, and we are working as a collective to be able to go back out to commission that infrastructure coordination function because of its vitality and importance. This isn't a nice to do. This, for me, is an essential. Back to Neil's point, if we don't have better creativity of how we mobilise and build the scale of our voluntary sector, we've heard today a lot about signposting and referring. That isn't like this empty pit of like endless capacity within the voluntary sector. So all of this referral has to land somewhere, and actually if we don't invest in this as a system, then we won't get what we want out of it as well. We've worked really hard to shift the relationship with voluntary sector to be a strategic partner, and so that they're not just at the end of the delivery and giving to us, because actually what they offer strategically is really insightful. So back to your point, Neil, we need to know from the voluntary sector where the gaps are from their perspective to be able to then look at how we shift some of the resourcing around. But I suppose one of my real reasons why I absolutely wanted this on the table for us to consider today is that this doesn't come for free. So it does have to come with that financial support and resilience around it as well. And that's one of the key things that we're working on with voluntary sector. That sustainability conversation is critical. And finally, trailer, because you're coming back in August, aren't you? Because one of the newer networks under Thriving Together was financial wellbeing, because we saw the pockets of good work happening, but it wasn't joined up as a collective, whether that be faith communities or citizens advice or even NCT. So the newer piece of work for this 2024 has been that bringing together as a financial wellbeing network. So it'll be really good to hear that development in the August meeting. So. But thank you, and I know Abby couldn't be with us, but thank you very much for presenting, Emma.
Any other questions for Emma? No? Oh, thank you very much. Thank you. Jill just mentioned there will be a financial well-being, again being presented by Emma Richardson, and also women's health. You have some concerns or some requests regarding the next month's program, Peter?
Thank you, Chairman. It's not a concern. It's simply to mention that the Health Watch annual report would have been on this month's agenda. It would have actually fitted really nicely in with these other presentations as a fellow listening organisation. It was delayed by the pre-election period. It has been published this week, so it will be in circulation. So we'll be very happy to present that at the August meeting if that fits in with the agenda.
Thank you. So we will definitely consider that one. Penultimate item, urgent business. There is none I know of. So therefore we can move on. And the date of next meeting is Thursday, 8th August. And then the September meeting will be a closed session. Yeah, so let's bear that in mind, like the last one was. Thank you very much for attending, right? And welcome. Thank you for all your contributions. Cheers.